Understanding pediatric dentistry and how different it is from general dentistry. So pediatric dentistry, it's all about children. It's a specialization in dentistry that is all about children. For one to become a pediatric dentist, you have to first do your first degree in dentistry. So you study for 5 years and become a dentist. And then, of course, 1 year of internship, those are 6 years. And then after that, you do a master's in pediatric dentistry. So for pediatric dentistry, we study for a minimum of 3 years. There are some universities that study for like 4 years, but mine was 3 years, a 3-year course. So then you become a pediatric dentist, where your main focus is on children. With children, it involves infants, it involves children, and then it involves adolescents. In Uganda, the law says that a child is a person who is below 18 years. Anyone who can't consent for themselves below 18 years. So anyone below 18 years can be treated by a pediatric dentist. So that is the understanding of pediatric dentistry. Like, it's mainly focusing on children, their treatment, prevention, oral education of parents and caregivers about their children's oral health. Basically children's needs, and their treatment. And then when it comes to general dentistry, a general dentist is a dentist or a dental surgeon who has studied for 5 years in university to attain a degree. In Uganda, we call them public oral health dentists. We have those also who have done diploma. They are called public oral health dentists. The one for degree, they attain a degree in dental surgery. So that is for a PhD, or that is not a general. Okay, they can be in that category, but if I'm mainly talking about that dental surgeon, is the general dentist who has gone to school for those 5 years and attained their degree. So for a general dentist, when we are studying dentistry, they gain experience in all fields, not only pediatrics, but they get they gain experience in pediatrics, in adults, in treating adults, in treating generally. Like the way, if I can compare to medicine, a medical doctor, a medical officer can treat all the general things. But when you want to see a pediatrician, you go to a specific doctor who has studied that specialty in children. So that is how the difference comes in. It's a new specialty in Uganda, I can say, because currently I think we are only 3 in Uganda, 3 pediatric dentists in Uganda. Yes. So it's a new thing, because they don't teach it in the main university, in Makerere University. We have to study it from outside. That master's is not taught in Makerere or any other university in Uganda. They teach the undergraduate dental surgeons and dentists, but they don't teach the masters in pediatric dentistry here. So we usually have to go outside Uganda to study it. And I believe it's a good thing, because the more it develops, I believe we shall have children treated better, and oral health as a whole will be on top.
Perfect.